Madam Speaker, my question is for the Minister of Health and Wellness. For many Nova Scotians, the cost of birth control prevents them from accessing this basic form of health care. It's estimated that 1 in 3 Nova Scotian workers do not have health benefits, and not all benefit plans offer equal coverage of the care. Insufficient access to birth control leads to worsened health, well-being, and socioeconomic outcomes for patients, families, and communities. The minister has worked extensively as a healthcare provider. Does she find it acceptable that so many Nova Scotians can't access this important medication?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. Thank the member for the question. So certainly we're looking at universal birth control over the last number of months. We know that there are a number of people through family pharmacare who can access birth control, providing that there is a medication component. So I certainly know in the instance of IUDs, in order for those to be covered under family pharmacare, there does need to be a medicinal and hormonal component to that. We continue to look at ways to support Nova Scotians. We also know that through Department of Community Services as well, there's free birth control available to those who meet the criteria. So we are working all the time to best cover things that are important to Nova Scotians, and we'll continue to do that review. Thank you.
The Honourable Member for Dartmouth North.
Minister will know that there are gaps in providing contraception, Madam Speaker. And so earlier this year, British Columbia became the first province to provide access to free prescription contraception. Nova Scotia needs to follow suit. It's estimated that for every $1 on contraception access spent on contraception access, there's up to $90 in public savings. The Access Now Nova Scotia Coalition has called on government to urgently address this issue, supported by organizations like the Pharmacy Association of Nova Scotia, Nova Scotia College of Family Physicians, the Dalhousie Departments of Pediatrics and Obstetrics and Gynecology, the North End Community Health Centre, and many, many others, and I will table that list. Will the minister commit to ensuring that every Nova Scotian has access to no-cost contraception?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. I thank the member for the question. So our pharmacare program is under incredible pressure, as we all know. Not only do we have advancing technologies and therapies, but we also know that the cost of drugs are going up. So as a department, we continue to look at what we're best able to supply to Nova Scotians. We want to make sure that we have things that are accessible to them that are needed. There is always competing priorities, and we will continue to balance and look at those over the coming months, and we will do what we can to support Nova Scotians.